Hi, thanks for being here again. We live in the Rio Grande Valley. Unfortunately, we're known as one of the most obese counties in the country, one of the poorest. Education levels are not where we want them to be, and we have one of the highest rates of diabetes in the whole country. What are some of those risk factors that make us have that diabetes that's so high? It can cause so many complications. The kidneys, the eyes, and of course the foot. What are those factors that just make us prone to having these complications? Well, one, and probably one of the most important ones, is high sugars. Having diabetes is not easy, and we all know that. And when I see my patients, I educate them on how they can do better with their diabetes. And that's why we need the help of the internist, the family practice, the endocrinologist, the team approach to people with diabetes. It's just not one provider, it's a group of us putting all that we know together to help that patient with diabetes. And it's never enough for that person with diabetes to hear about it just once. Every time they go to their physician, to their podiatrist, to their endocrinologist, they should hear about how they need to take care of themselves. But high blood sugars is one of the things that really gets you. It's kind of, sometimes I laugh with my patients because they'll come in and they'll tell me, "Doc, my blood sugars are great. They're 120 today, and that's wonderful, and that's great, and we want them to be there." But I ask them, "What was it yesterday?" "Oh, it was 200. Well, that fluctuation of the blood sugar up and down is even worse than having it high all the time. We don't want it high all the time. We want it to be normal all the time. But that up and down, that seesaw up and down really plays havoc on our bodies. And so we need to control our sugars. And how do we do that? We have to watch what we eat. It's difficult dealing with diabetes, but it's not impossible. And if you take care of yourself, you'll take care of the complications that can come with the diabetes, whether it be retinopathy, where you can't see, bleeding in your eyes, or your kidney problems. How many people do you know that are on renal dialysis because of diabetes? Or how many people have you seen with loss of a toe or loss of their leg because of complications of diabetes? So one, you want to take care of your blood sugars. That's the most important thing you can do. Talk to your family doctor, your internist, your endocrinologist about what diet you can follow. Maybe they can even send you to a dietitian to help you get on the right plan. What can you do to help prevent things in your foot? Wearing the right footwear is number one. What does that consist of? What is that? Well, you want to make sure that if you have any risk factors, neuropathy, lack of sensation, we've talked about this in the past, or you have poor circulation, we want to address those. Now, people with diabetes and neuropathy, lack of sensation, should not wear regular shoes. We have diabetic shoes that are special for people with diabetes, which are one, wide enough, and two, high enough where you can put insoles in there that help take away the pressure that's on the bottom of that foot, so you don't get the calluses and you don't get the ulcers that come from increased pressure. So if you have diabetes, you should at least see your podiatrist once a year and be checked to make sure you have no bad circulation, no neuropathy, no lack of sensation. Because if you have those factors, that increases the risks of having a diabetic foot ulcer. And also, if you have increased sugars, it decreases the chance of that ulceration healing. What else shouldn't you do? Well, people laugh at when I say this, but you should be taking knives, forks, corkscrews, utility blades to your feet to cut calluses, to cut toenails. I'm amazed at how many people come to see me and they're sent by their primary doctors to see me for what we call diabetic foot care, where we trim their calluses, their nails, we evaluate their feet. And they trim their nails the day before they come, and they're all cut when they come. And they're all bleeding because they cut their skin because they can't see because of the retinopathy. Or they cut their callus and now they have an open wound because they went too far. Visit your podiatrist. Let them evaluate you. Let them take care of your toenails, your calluses. Let them recommend the shoe that's going to be adequate for your foot. That's what we do. We are the specialist in foot and ankle, whether it be corns, calluses, toenail fungus, trimming toenails, treating your ulcerations. We are the experts, and we have done this. And so see your podiatrist, and you don't have to cut your toenails before you come. We'll do that for you. We have people that are trained to do that. So the risk factors are, don't take knives, forks, corkscrews, utility knives to your feet. Wear adequate shoes. I can't tell you how many people have amputated a toe or half their foot or lost their leg because they wore a tight shoe, maybe just to church for an hour. And I always tell them, God doesn't care what you wear to church as long as you go. Or I went to the birthday party and I just wore that shoe for 1 hour and now it rubbed a blister, but I have bad circulation and I can't heal it and I can't open it up. There's no way to open up that circulation. And now you're going to lose your leg because of that. Difficult? Yes. Impossible? No. Remember, you're with yourself 24/7. You'll see your doctors maybe once every 3 months for 10 or 15 minutes. You need to think about how you're going to protect yourself from ulcerations and amputations, from eye disease and kidney disease. We're here to help you do that, but you have to help yourself. I look forward to seeing you again. Have a great day.